Kiwis love being outdoors, so why not transform your outdoor living space with a Sunview? With our quality range of stylish pergolas, outdoor blinds and awnings, having a Sunview is like adding a new room to your home, but for a fraction of the price. Enjoy the outdoors all year round with a range of products to suit your needs. Book a free consultation now with Sunview and see the difference.
Our after-hours healthcare services are under significant strain. Many clinics reducing their hours or closing due to staff shortages and financial challenges. In the first 8 months of last year, 24 clinics had to cut their hours or shut the doors. And Auckland's urgent care clinics closed early, nearly 200 times due to staffing shortages. The closure of the only overnight GP service between Whangarei and Auckland's North Shore in March exemplifies the growing crisis. In response, new funding of $164 million has been allocated over the next 4 years, with 24-hour urgent care clinics identified for counties Manukau, Whangarei, Palmerston North, Tauranga and Dunedin. The funding boost also covers new and extended daytime services for other centres, Leah, including Lower Hutt, Invercargill and Timaru. Now, rural areas are particularly affected, with proposals like the one on the West Coast to replace weekend and after-hours GP services with telehealth consultation, raising concerns. Critics argue that such measures fail to consider unique challenges of rural communities, including limited internet connectivity and the need for face-to-face care. Dr. Luke Bradford is a medical director of the Royal New Zealand College of General Practitioners, and he joins me now. Luke, a very good afternoon to you.
Hi, Leah. How are you?
Well, I'm very good. Now, this is, given the large number of clinics that have been forced to reduce or close completely, will this funding be able to address in a meaningful way the challenges we're seeing at the moment?
It's definitely a good start and a good acknowledgement that the sector wasn't able to function on the model that they had. I mean, those clinics were shut in essentially because of a viability issue. The funding for them and the charges that they could pass on to patients just didn't cover the costs, and they couldn't find staff to fill them. So this money is going to help. Whether it does everything that it's lined up to do, I think we'll have to wait and see, but it is a start.
Yeah. The funding aims to establish new 24-hour urgent care clinics for several regions that I touched on. From your perspective, Luke, what are the logistical hurdles about setting this up? Is the biggest issue, I can imagine, staffing?
Yeah, absolutely. You've got to find staff who are willing and able to work night shifts and sufficient to cover leave, and the fact that people don't want to work nights regular as a general rule. I think that the wording's quite vague in the proposal. It says clinicians. I suspect they'll be mostly nurse and paramedic led, but we still with telehealth backup. I'd have thought, and the EDs locally. But again, it is about finding those people who are willing and able to do it. And of course, if you're running an overnight clinic, you can't just put one person in a building on their own all night who is going to be with sick people. You do have to, for safety measures, have at least a two-person staffing situation.
Yeah. I want to touch on that a little later on. Yeah, I thought of that as well. Can we talk about the rural areas, particularly I brought up the West Coast? There's a push towards telehealth consultations to replace in-person. And I understand with staffing issues, this could be the alternative. But how effective do you think this approach is, Luke, considering, the unique challenges of rural communities and that face-to-face that a lot of us like?
Yeah, look, and I think we're absolutely in between a rock and a hard place here. So we know that getting care from a doctor who knows you and has looked after you for a period of time is going to lead to the best outcomes. We know that there's a lot of times where people don't have connectivity, either broadband's no good or they haven't got credit to do it. And we know that sometimes you have to be seen, you have to be examined, you have to be treated. So that absolutely, we know all of those is the case. But we also know that in a lot of rural places that there'll be one or two doctors or a nurse practitioner trying to run 24/7 care, and those guys are can't keep it up. They just can't keep doing that.
We know that preventative care, the lack of, leads to increased emergency visits. People that either can't get in with the doctor, can't afford the doctor, and then they present at ED. How can this new funding, how much, or again, devil's in the detail, to be directed to break this cycle or strengthen primary care?
Yeah, I don't think any of it's destined for primary care, for general practice. It will take the pressure off EDs. It will allow people to be seen closer to home or get medical advice closer to home. And urgent care does fulfill a vital role in that space, sees thousands and thousands of people a year. So it is important, but no, it's not going to free up capacity directly or allow people into general practice. I don't think.
The capitation funding model, Luke's been quite the topic of debate. Do you think the current funding structures adequately support GPs without over-relying on patient co-payments?
No, absolutely not. No, there's been a lot of work done, and government-led work and commissioned work that shows two things. Firstly, sorry about that. Firstly, the capitation weighting, the way we split it up, isn't detailed or appropriate. So at the moment, capitation is based purely on your gender and age groups, and the age groups cut off at 65. We know that actually we need to target that much better around age, something called comorbidity, so how sick you are, how much care you need. Rurality, we know rural guys and girls need more care, ethnicity and deprivation. And secondly, we know that actually general practice has been underfunded for about 19 out of 20 years in terms of below inflation price rises, payments from the government, and therefore the studies have shown 4 years ago we were at least 14% below viable funding levels, and that will be nearer 20 now. So one of the things this is one of the problems with this health announcement is that you're going to need to staff it. It's going to rely on general practitioners and urgent care doctors who want to do more work as they open more clinics in the after hours. And we have to attract them into the profession. And so it's a phenomenal profession. We get to look after families through their life courses, do some really good stuff, but it is underfunded, and therefore we struggle to recruit people in and retain them when they come. So fixing the capitation model properly will allow us to really bring in those best and brightest doctors.
Yeah. You mentioned a bit earlier about, if we've got these 24/7 clinics, to get the staff to cover them, we're going to have to look at their safety. We can't just, as you say, have one nurse or clinician just wandering around there. So, I mean, that's going to, are you meaning like more staff on or security? Does it matter?
Kiwis love being outdoors, so why not transform your outdoor living space with a Sunview? With our quality range of stylish pergolas, outdoor blinds and awnings, having a Sunview is like adding a new room to your home, but for a fraction of the price. Enjoy the outdoors all year round with a range of products to suit your needs. Book a free consultation now with Sunview and see the difference.